also to describe the common lung diseases. Please prepare the following: ball pen and paper. Our topic for today is one of the most important organ in our body, which is lungs. Lungs are a pair of spongy elastic organs that carry out the major breathing function of the body. They lie in the upper chest cavity from the collarbone down to the diaphragm. The lungs are the lightest organs in the body, where exchanges gases take place. At birth, the lungs are pink, but when a person ages, they become gray and mottled from a tiny breath in with the air. Now let's proceed the parts of the lungs and their functions. First, the lungs are important and delicate organs that are protected by a set of bones called the rib cage. See the sample picture. So this is the picture of our lungs that is covered and protected by our rib cage. Our rib cage is formed of chest cavity and where the lungs are found and well protected. The human body normally have 12 pairs of ribs. Next is cilia. It protects the lungs from the dust particles. Next is the pleura, a thin membrane that covers the left and right lobes. Diaphragm. It is a large, dome-shaped muscle that stretches across the base of the chest cavity and separates the chest cavity from the abdomen. It is the chief muscle used in breathing. The lung has 300 million alveoli, where the lungs and the blood exchange oxygen and carbon dioxide during the process of breathing in and breathing out. And each alveoli is surrounded by tiny blood vessels called capillaries. And it is where the oxygen and nutrients are exchanged for carbon dioxide and waste. How the lungs work? It is controlled by your brain. The muscles of your body work automatically so that you can breathe without having to think about it. You also use the air in your lungs to breathe out when you speak, sing, shout, or blow up a balloon. How can we get the disease that may affect the lungs? Germs that are present in the air we breathe cause the lung diseases. They enter the body when they go with the inhaled air. And also, direct contact with people who have lung diseases. Now let's proceed to the disease that affect the lungs. First is asthma. This is the lung disease that is chronic and long-lasting. What is the symptoms? Shortness of breath, wheezing, and coughing. And here is the treatment. Taking prescribed drugs to relax the bronchial muscles and open up passages relieve asthma attacks. Next is bronchitis. It is an inflammation of mucous membrane caused by bacteria, viruses, or irritants. The symptoms is hoarseness, fever, and cough. The treatment is taking antibiotics. Next disease is pneumonia. It is an acute inflammation of lungs caused by bacterial infection, a high communicable disease that mostly develops a complication of other respiratory infections such as flu. Pneumonia is a very common disease nowadays during the pandemic. The symptoms of pneumonia are fever, chilling, difficulty in breathing, and chest pains. The treatment, it depends on the type of infection that is present. As per advice, patient must drink plenty fluids or drink more water and have enough rest and take prescribed antibiotics. Next is tuberculosis or TB. It is a tubercle bacilli or a germs that causes TB. It also affects different parts of the body like kidneys, bones, and brain. It can easily transmit by direct contact or airborne viruses and bacteria. And here's the symptoms. Dry severe coughing, palpitation, loss of appetite and weight, fatigue, sweating, especially in the evening, fever in afternoon or in the evening, chest pains, and having blood in the sputum if severe. So here's the treatment for tuberculosis. Have enough rest, good diet, have plenty of fresh air and sunlight, and also have a regular medical checkup. Next is emphysema. It is a chronic lung disease that is most common in middle-aged or older people. It is caused by carbon dioxide trapped inside the alveoli because of cigarette smoking. What are the symptoms? First is difficulty in exhaling, general weakness, shortness of breath, and declined body efficiency. The treatment of emphysema is very limited because of permanent lung damage. Disability and death may be the result of this disease. Next is lung cancer. It is a deadly disease which cells grow wildly and lumps are developed. The main cause is smoking. Prevention and treatment of cancer includes regular checkup and taking in prescribed medicines. Also, avoid smoking. Now let's discuss the proper way of taking care of our lungs. First, avoid going to crowded areas and places with polluted air where you may contract lung diseases. Always cover your mouth and nose when passing by dusty and polluted areas. You may also wear a mask so as not to inhale dirt or dust. Next, use clean, soft cloth or tissue paper to clean your nose regularly. And stay away from smoke because you may inhale the carbon monoxide of the cigarettes. Also, avoid direct contact with people affected with lung diseases, and always keep your surroundings clean and pollution-free. Dispose the garbage properly. The best thing to do is to exercise deep breathing once in a while to allow all the carbon dioxides in the body to be breathed out. And change wet clothes after work or playing. You must eat well-balanced diet with plenty of fruits and vegetables that are rich in vitamin A and C. Also, have enough rest and sleep. Then, drink plenty of water and fruit juice for smooth functioning of the lungs and prevention against catching colds. And lastly, have a regular medical checkup. Use drugs and medications only upon proper recommendation from the doctor. And that's all for today's lesson, and see you on the next video. Bye!